What is going on, world? Hey, what's up? How y'all doing? Today is Monday. You guys already know what the deal is. We're going to be doing questions today. Hey, how y'all doing? Hey, hopefully everybody had a good weekend. Hey, I just got finished watching that GTA 6 trailer. Hey, shout out to all my gamers out there. Big gamer, big nerd at heart. The game's going to be fire. So, enough, I guess... Shout out to all my people that like playing video games. And if I got some anime nerds up in here, hey, ain't nothing wrong with that either. Hey, if you guys are new here, welcome. We are going to be doing NCLEX questions. Today is Monday. You guys already know the deal. We're doing NCLEX questions. Got them off nurseslabs.com. Need for you guys to like, share, follow. That is the most important thing that gets us out there to folks. Spicy said, "What's up, Kev? What's up, Spicy? 57, I see you out there. Who else is in here? Right on time, Sky. Look. What's up? Hey, we don't miss around here. We stand on all 10 toes. On business. That's what we're about. So, is it Anna? How are you? Hey, by the way, guys, everybody's been asking me if I do tutoring for like ATI, HESI, besides NCLEX, and I created one. If you guys go to the link in my bio, it'll say private tutoring call where we talk about ATI, we talk about HESI. We want to talk about whatever you got going on in nursing school, all that stuff. So if you guys go check that link in my bio, it is there as well. What's up, Bella? I see you. Army nurse girl, I see you out there. Hey, you guys already know the deal. Once we get 100 people up in here, I'm turning this camera around. You guys ain't got to look at me no more. Well, at least until the end. And then, we can get it on and popping. All right. Hey, so make sure you guys like that, make sure you guys like the stream, make sure you guys share, make sure you guys follow. My allergies been acting up, so my eyeballs look a little puffy. Then you guys already know what the deal is. All right. Also, I made an ebook. I call it the NCLEX Victory Guide. You guys can check that out as well in my bio, and it is labeled the NCLEX Victory Guide as an ebook. You guys can go over there. Hey, look, I made a whole bunch of stuff for y'all this weekend, and I got a whole bunch of other stuff coming up. And coming down the pipeline, I have something that I like to call making shit happen, aka going on a tour of duty with me. Kind of like a little military aspect. Going on a tour of duty with me. What's up, Rach? How are you? Hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys share. Make sure you guys follow. Make sure you guys give me all those likes. All three of those help get this to the people that need it. Did you just start? I did just start. I'm just waiting for, once we get 100 people up in here, then I'm turning around and I'm going to give you guys these questions. It says I take my ATI exit tomorrow. Okay, Bella, hey, you Gucci. You good to go. You good to go out there. So, hey, I want to know who you are, where you're from. Okay, is it Rocio? I know a Rocio. From Chicago. All right. Yes. Finally, I'm on time. Hey, yeah, we here. Look at me being early. Army nurse, you just being here at all surprises me. Hey, what's up? Hey, so you guys already know the deal. What did you guys do this weekend? Hey, we just waiting for us to get 100 folks up in here. I usually try to give it about a good 5 or 6 minutes, and then that's when stuff starts piling up. So see what's going on. Nepal. Okay. Is it Abisha from Nepal? Shout out to you. South America. Is it Roz? Whereabouts in South America? It says taking my intro and health assessment final tomorrow. Ready for second semester. I know that's right. You drank all weekend? Of course you did. Why am I not surprised? Karen, what's up? Karen, and never miss a beat. Already got that license and already it still be coming here. I love it. It says I'm an RN from the Philippines, anesthesia aide here in Canada. Okay, shout out to you. Is it Suriname? Oh, you're Suriname? Hey, so I actually dealt with a couple of Suriname Defense Forces last year when I did a military exercise. I loved everybody that came up. So, all right, don't embarrass me. Look, you embarrass yourself. You said it. All right, y'all. Since, we give it a good little 5 minutes, but, apparently I didn't hit my 100 people mark because nobody likes me. So I'm just going to turn this thing around. All right, y'all. You guys already know the deal. We're doing NCLEX questions. Make sure you guys participate. Smash that like button, y'all. We need 10,000 likes. Make it happen. Bella, get on it. Get carpal tunnel for me. You know the deal. Hey, make sure you guys share, follow, give me all those likes. Hey, y'all already know that's what we need to get. That's what we need to get out here. You know what I'm saying? Trying to be seen. Don't be selfish. Also, troll my chat. You getting banned. Nurseslabs.com is where I got these questions from. 7-day NCLEX course, still $97. Hey, there's a free download on my website. Go over there and check that out. Also, I do tutoring. Hey, like I said, I also added a private call, which is a little bit more affordable than for some people because they were asking. So, hey, talk about ATI, talk about NCLEX, talk about HESI. If you're in nursing school, we talk about whatever. So we make some stuff happen. All right, here we go. Question number 1. A client with bacterial pneumonia is admitted to the pediatric unit. What would the nurse expect the admitting assessment to reveal? Is it high fever, non-productive cough, rhinitis, or vomiting and diarrhea? I'm going to put y'all on a timer, too, because y'all take too long to answer. What up? It says, I'm here to control the chat. My man, Jay, hey, control it. Hey, command and conquer, control the chat. We see what's going on. All right, what are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Hey, make sure you guys smash that like button. You know, make sure you guys give it a share, give it a follow, give it as many shares as you can, because that's what TikTok likes, y'all. That's what TikTok likes, to get folks out here. All right, get it out there. All right, y'all. Hey, like I said, these are nurseslabs.com. These are free sets of questions. You know what I'm saying? Don't be complaining if it's free. You know what I'm saying? Hey, sometimes free is cool. You know what I'm saying? Here we go. Here's our answer, y'all. Here is our answer in 3. Hold on. 2, 1. There we go. And the answer is high fever. If the child has bacterial pneumonia, a high fever is usually present. Increased temperature or fever with tachycardia and or chills and sweats is a major clinical finding. Physical findings also vary from patient to patient and mainly depend on the severity of lung consolidation, the type of organism, the extent of the infection, host factors, and existence or non-existence of pleural effusion. That is part of physiological integrity or physiological adaptation, which is the third largest section on the NCLEX exam. Okay, at what 11 to 17%. All right, here we go. Question number 2. The nurse is caring for a client admitted with epiglottitis. Paint the picture. All right. Paint the picture. Because of the possibility of complete obstruction of the airway, which of the following should the nurse have available? Is it IV access supplies, the trach set? What is it? IV fluid, administration pump, or supplemental oxygen? What are we thinking? Who's that? Bella said it would be viral. Yup. Look at you. Shout out to everybody that's here. Hey, I got these questions off nurseslabs.com. Make sure you guys like, share, follow. On the road to 10,000 likes. 10,000 likes. And if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. Jay, bro, you know, there's no E over there, bro. What do you mean? What do you mean, my guy? I've been paying attention. Look, Bella, I see you be paying attention. You about to write. You about to kill that ATI. You about to kill that NCLEX. Girl, I ain't worried about you. I'm here to press the like. Hey, Karen, I appreciate you. Smash that like button. Intubation. Okay, Jay, I'm just saying, man. There's no E out there. I mean, come on, my CRNA guy. Come on now. All right, y'all. Here we go. Here's our answer. Here's our answer in 3, 2, and the answer is B, the tracheostomy set. For a child with epiglottitis and the possibility of complete obstruction of the airway, emergency tracheostomy equipment should always be kept at the bedside. Prepare for intubation or tracheostomy. Anticipate the need of an artificial airway. An artificial airway is required to promote oxygenation and ventilation and prevent aspiration. That is part of safe and effective care environment, which is part of management of care. All right. Largest section on the NCLEX, 18 to 23%. All right. Here we go. Question number 3. A 25-year-old with Graves' disease is admitted to the unit. What would the nurse expect the admitting assessment to reveal? Bradycardia, decreased appetite, exophthalmos, or weight gain. So what's another name for Graves' disease if you don't know? All right. These are how you use and utilize your critical thinking in order for you to make a clinical judgment. All right. Also, hey, y'all, I made an ebook. You guys can go check that ebook over there. The link is in my bio. It's called the NCLEX Victory Guide. Hey, I have over 700 pages, y'all, of all just essentially everything that you could remotely want. There's a lot of pharmacology in there for both RNs and LPNs. All right. Y'all can go over there and check that out. Is it also called Addison's? Addison's is so we're talking about Graves' disease. What part is Graves' disease? All right, y'all, here we go. And our answer is 3, 2, there we go, thyroid. Here we go. And the answer is exophthalmos, which is protrusion of eyeballs, right? Often occur with hyperthyroidism. Graves is caused by inflammation, cellular proliferation, and increased growth of extraocular muscles and retroorbital connective and adipose tissues due to the action of thyroid stimulating antibodies and cytokines released by the cytokine T lymphocytes. All right, that is part of physiological integrity, which is the third largest section on the NCLEX at 11 to 17%. Y'all, stop playing with me, y'all. Stop playing with me, right? So, make sure, guys, you got to make sure, like, when we review, you're not going to know all the answers, right? This is why it's called a review. I'm not going to know all the answers either. Hey, but I'm here. I'm here with y'all. You know what I'm saying? And I'll be like, oh man, I forgot. Hey, I've been working as a nurse for a while, so hey, sometimes I'll be bringing the real life, to the perfect life, and that's what NCLEX is all about. All right. Here we go. Question number 4. The nurse is providing dietary instructions to the mother of an 8-year-old diagnosed with celiac disease. Which of the following foods, if selected by the mother, would indicate her understanding of the dietary instructions? Is it A, ham or ham sandwich or whole wheat toast? Spaghetti and meatballs, hamburger with ketchup, or a cheese omelet? Omelette du fromage. Hey, who remember that? Hey, shout out to Dexter. Anybody? All right, cool. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. These are both for RN and LPN students. So make sure you guys go over there and check those out. Make sure you guys smash the like button. Make sure you guys share. Make sure you guys follow. That is the trifecta that TikTok needs. And that's kind of what I want. So stop being greedy. And if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. 10 seconds. 10 seconds. What are we thinking? Everybody screaming D. All right, well, let's find out. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is D, cheese omelet. A child with celiac disease should be on a gluten-free diet. Mostly it's because of celiac. Not because, it's a fad. When a child has celiac disease, gluten causes the immune system to damage or destroy villi. Villi are the tiny finger-like tubules that line the small intestine. All right, that is part of health promotions and maintenance. Make sure you guys, when you are doing your questions, you are reading you're doing your content, reading your questions, answering them with Q&A, and doing your rationales. Even if you got them right, you need to be doing them. That is how you solidify and hold that information. Okay, here we go. Question number 5. Wait, 1K what? Oh, you sent 1K what? What happened? I don't know what happened. Oh, you sent 1K likes? I appreciate you. The nurse is caring for an 80-year-old with chronic bronchitis. Upon the morning rounds, the nurse finds the O2 sat at 76%. Lord of mercy. Which of the following actions should the nurse take first? Notify the physician, recheck the O2 sat level every 15 minutes, apply oxygen by mask, or assess the pulse. What are we thinking? Shout out to the 1,000 likes. That's what I'm talking about. I appreciate y'all. What are we thinking, y'all? What are we thinking? Hopefully everybody had a good weekend. Want to know who you are, where you're from, where you're at in your nursing journey. Also, if you're not a nurse, what are you doing here hanging out with us? And then tell me what you did this weekend. Hopefully it was something legal. I know Bella didn't do nothing legal besides drink wine and drink and drive. Don't drink and drive, ladies and gentlemen. All right, don't be her. I'm just playing, Bella. I'm just playing. That's 95. Yeah. All right, here we go, y'all. Here's our answer. Jay, look, man. Hey, you ain't got to tell me nothing, man. I know the deal. CRNA school, bro. CRNA school. And 3, 2. And the answer is apply oxygen by mask. Remember, the ABCs are as easy as 1, 2, 3. ABCs when answering this question. Administer oxygen first to increase the O2 saturation level. That is physiological integrity. All right, physiological adaptation, third largest section on the NCLEX at 11 to 17%. Hey, don't forget, physiological adaptation, management of care, and pharmacology make up the 3 largest sections on the NCLEX from 44 to 49%, almost half, okay? Hey, so real quick, doing NCLEX questions for RNs and LPNs. Make sure you guys participate. I'm kind of funny sometimes. It's the weekend. My allergies is kind of messed up, but y'all already know the deal. Hey, share, follow. Give me all those likes, all right? Hey, we need 10,000 likes, y'all. 10,000 likes. Because, hey, these are the tiers that we got to hit, and y'all got to hit them. You know what I'm saying? Don't be selfish your whole life. Don't troll my chat, or I'm going to ban you. Nurseslabs.com is where I got these questions from. All right? They're free sets of questions. And if you're a new nurse, hey, go over there and check out their care plan stuff for, nursing diagnosis. Trust and believe me, you wouldn't be the first person to use it. And if somebody gets scared saying that you cheated, there's something wrong with them. Okay? 7-day NCLEX course. That is my NCLEX course. That's $97. You get it for a lifetime. One of the biggest flexes you could have is say, yeah, you had an NCLEX course for $97. You get a free download at the website. Go check that out. Also, if you're looking for tutoring, one-on-one call, coaching on NCLEX, all those links are in my bio. All right, here we go. Question number 6. A Gravida 3 Para 0 is admitted to the labor and delivery unit. The doctor performs an amniotomy. Oh my God. See, tongue twister. Which observation would the nurse be expected to make after the amniotomy, right? Is it a fetal heart tone of 160, a moderate amount of straw-colored fluid, a small amount of greenish fluid, or a small segment of the umbilical cord? What are we thinking? Hey, sometimes your boy can't pronounce stuff, and that's all good. You know what I'm saying? I've had so many people. I've had people message me and tell me they were just like, "Hey, you should really work on your public speaking." And I was just like, that's coming from a motherfucker who don't go on here and public speak. But whatever. I'll take that opinion like with a grain of salt. You know what I'm saying? All right, we got D's, we got some B's. Sky, that's okay. Hey, that's all right. Give me one. Haven't learned this yet. Hey, that's cool. That's cool. Get your learn on. That's what this is all about, is getting your learn on. Hey, if you guys are new here, welcome. We got these questions off nurseslabs.com. All right. Hey, so this would be a really great section for you guys to look over if you have already been through maternity, labor and delivery, mother, baby, whatever. Okay. This is definitely one of those ones you want to look over, because before you know it, the exam will literally give you questions about nothing but mother, baby, and then you're going to be pissed off. But the answer is B, a moderate amount of straw-colored fluid. The amniotomy is an artificial rupture of membrane, and normal amniotic fluid is straw-colored and odorless. A successful rupture of membranes most commonly is determined by the immediate return of amniotic fluid from the vagina. This fluid usually is clear and odorless. Physiological integrity or adaptation, third largest section on the NCLEX. All right. Yeah. That's what I'm talking about. You think A? Hey, well, it was B, Ty. It was B. So it's all good. Hey, remember, this is where you guys learn, right? Nobody's being graded on this. This is just something internally that you have to realize that, hey, I don't know this stuff. Even if some people say that it's simple and I have to do better. I'd be freaking out if someone poked my bubble 160 meters. Hey, look. You're right. I'd be like, hey, bro, what are you doing to my first apartment? Chill out. Here we go. Question number 7. The client is admitted to the unit. The vaginal exam reveals that she is 20 centimeters dilated. Which of the following statements would the nurse expect her to make? Is it A, we have a name picked out for the baby? B, I need to push when I have a contraction? C, I can't concentrate if anyone is touching me? Or D, when can I get my epidural? What are we thinking? Hey, if you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're lurking, I want to know why you ain't participating and why you're not smashing that like button and why you're not sharing, huh? That's what I want to know. All right, everybody's saying D. Okay, Toronto, Canada. Okay. Hey, and Drake from there? I'm just saying. Oh, yeah, we had this question before. We might have. Hey, a lot of these questions are recycled that they have on the website, so we might have. I still need to know how to subtract likes. What you mean? Bella? I wish you could. Shout out to Nolans. All right, y'all. Here we go. Here's our answer. In 3, 2. And the answer is D. When can I get my epidural? Dilation of 2 centimeter marks the end of the latent phase of labor. All right. Hey, remember, with labor and delivery, there are stages and there are phases. Do not get them confused. OK, during the latent phase, the cervix dilates slowly to approximately 6 centimeters. The latent phase is generally considerably longer and less predictable with regard to the rate of cervix change than is observed in the active phase. OK, so, yeah, physiological integrity. Third largest section on the NCLEX, 11 to 17%. Do not get them confused. Trust and believe me. Even I had to go back and I had to look at a couple things, and I was just like, bro, hold on. Let me remember what the phases and the stages were. I don't work in labor and delivery. Never planned on it. I don't want to be near anybody's. Yep. Sure don't. Not my thing. So, yeah, definitely do not get those confused, because if you get them confused, you will get that question wrong. OK, question number 8. The client is having fetal heart rates of 90 to 110. During contractions, the first action the nurse should take is what? Reposition the monitor, turn the patient to her left side, ask the client to ambulate, or prepare the client for delivery. What are we thinking? Hey, Jay, I don't know if I told you my story about when I was in clinicals for labor and delivery, but I essentially walked in to an episode of Maury where there were just, young lady giving birth, and there was 4 dudes in there. And yeah, so I'm good. I don't ever want to be in there ever again, unless I'm having my own kids. Oh, man. Hey, shout out to all 41 of y'all in here rocking with me. Like I said, I want to know who you guys are, where you're from, where you're at in your nursing journey. If you have not already told me, Bella, don't want to hear nothing from you. We already know where you're from, all that stuff. But the other Bella, you can tell me, just not Bella. Where everybody at? Hey, look, on Friday we was popping, and then like last Tuesday we didn't have nobody here. Yeah, you about to be 30. What you mean? Here we go. Here we go. And the answer is B. Turn the client to her left side. The normal fetal heart tone is 120 to 160. 100 to 110 is bradycardia. The first action would be to turn the client to the left side and apply oxygen. All right. Physiological integrity. All right. Winnipeg. Okay. Winnipeg. Only thing. Okay. I'm not even gonna be ignorant because I'll be saying some wild stuff. So like, he getting on your look. I'm trying to tell you. Nashville, Tennessee. Hey, I just want to let you know the Nashville hot, probably one of the best things I've ever had in my life. Okay. Didn't the other question say 160 was tacky? No. Did it? It might have. Possibly. Connecticut, North Carolina. Okay. All right. Here we go. Question 39. Question. I said 39 because that's what Jay said, but question 9. In evaluating the effectiveness of IV Pitocin for a client with secondary dystocia, the nurse should expect what? A painless delivery, cervical effacement, infrequent contractions, or progressive cervical dilation. D. Okay. All right, Bella. You ain't got to yell at me. Okay. I see it on there. All right. God, can't even be normal. Jessica's said D. Okay. Oh, anticoagulant. I didn't even see you in here answering. Oh, man. It says B. All right. Cool. Cass says D. Oh, Cass. I forgot Cass was here. Hey, Cass said the answer, y'all. So you already know it's right. Savannah, what is V? What you mean? That answer ain't even on here. Not sure. C. That's okay. Hey, if you don't know, I would rather you just guess. You have a 25% chance of getting it right than not answering it at all and then getting it, having a 0% chance, right? All right, y'all. Here we go. Here's our answer. In 3, 2. And the answer is D, progressive cervical dilation. The expected effect of Pitocin is cervical dilation. Oxytocin is indicated and approved by the FDA for 2 specific time frames in the obstetric world. Antepartum and postpartum. Okay. Physiological integrity, 11 to 17%. All right. Okay. Yeah. Hey, y'all are rocking it. I appreciate y'all in all the participation that you guys are doing down there. All right. Here we go. Question number 10. A vaginal exam reveals a footling breech presentation. The nurse should take which of the following actions at this time? Anticipate the need for a cesarean section, apply the fetal heart monitor, was it place the client in the genupectoral position or perform an ultrasound? What are we thinking? Is always in the dilation. Centimeters, inches is always for dilation in OB. Oh, did somebody ask that question? Nurse Katie. I want to say A. Well, you already said it. You can't say you want to say it and then you say it. Come on. Appreciate everybody jumping in. You guys already know what the deal is. Hey, make sure you guys smash that like. Hey, 20,000 likes. 20,000 likes. Hey, whose turn is it? Whose turn is it to get carpal tunnel for me? I'm about to pick somebody at random. And it's gonna be Cass with the butterfly with the sparkles in the heart. Girl, you already know what the deal. Hey, get carpal tunnel for me right now. Make it happen. Make it happen right now. What you mean? I'm not sassy. Rougie, baby. What? You about to get carpal tunnel for me? Make it happen. That's what I'm talking about. I say this is my bro story. Wow. Okay. Here we he had a breech foot come through. Here we go. Here's our answer in 3, 2, and the answer is apply the fetal heart monitor. Apply a fetal heart monitor is the correct action at this time. Fetal heart sounds are heard high in the abdomen in breech presentation. Look, okay. Be certain to monitor the fetal heart tone and uterine contractions continuously to detect fetal distress early and provide prompt intervention. Look, okay. My mom lied. Look, so sometimes the question doesn't have to make sense to you. You just have to get it right. And if you don't get it right, you need to figure out why. This is why you read your rationale. It may be a whack question and it may be false. But that was it. It said, what do you do first? Right. But hey, I don't make the questions. I just read them. All right. And then sometimes I research them depending on what I got going on. You know what I'm saying? I didn't have enough time to do that today. So here we go. Hey, real quick, we're doing NCLEX questions. I appreciate everybody hanging out here. Make sure you guys participate. I'm kind of funny sometimes, but according to most, like Bella, I'm sassy, which is wild to me. I'm just like, can't I just be me? How you depict me is not a me problem. Bella, that's a you problem. You fix you, boo. Okay. Anyways, Share and follow and give me all them likes. Stop playing games with me, all right? Stop being selfish your whole life. Hey, if you troll my chat, I'm gonna ban you. I promise you. And I'm petty. And when I tell you I'm petty, I will talk shit about you at the end, and I will put you on blast. So don't do it. Nurseslabs.com is where I got these questions. Also, 7-day NCLEX course, ebook, tutoring sessions, coaching sessions, all that stuff is in the link in my bio. Hey, you also get a free download there too. All right, and we're gonna do an Ask Me Anything to follow after this. Okay, I got it. Mom said that there was a monitor to check first, then the cesarean section. Yeah. So the question was first. What do you do first? Hey, let's get a heart tone. See this baby alive. You know what I'm saying? I'm taking my board soon. Any advice? Study for it. I'm not though. I will roast you and I will thoroughly enjoy it. Here we go. Question number 11. A vaginal exam reveals that the cervix is 4 centimeters dilated with intact membranes and a fetal heart tone rate from 160 to 170 beats per minute. The nurse decides to apply an external fetal monitor. The rationale for this implementation is what? The cervix is closed, the membranes still intact, the fetal heart tone are within normal limits, the contractions are intense enough for insertion of an internal monitor. What are we thinking? Man, obviously I did not know how to read that. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. It says, you're welcome. Ma'am, I appreciate you. Hey, how your hands feel? Let me know. And now go ahead and put the phone on the floor and start tapping it with your toes. We got folks that are saying, B, I just sent you one like. Bella, that does not surprise me at all. You will miss, I want to take likes away from me. How dare you? I worked hard for these. Here we go. Here's our answer in 3, 2. And the answer is B. The membrane is still intact. The nurse decides to apply an external monitor because the membrane is intact. The test is used to determine if a fetus is at risk for intrauterine death or neonatal complications, usually secondary to high-risk pregnancies or suspected fetal hypoxemia. All right. Physiological integrity. Third largest section on the NCLEX. 11 to 17%. All right. 11 to 17%. All right, that was our answer, Bella. I don't even care what you. I'm about to just ban Bella. I think that's what I'm gonna do. There's a lot of labor and delivery questions on here. I hope y'all get them. Question number 12. The following are all nursing diagnosis appropriate for a gravida 1, para 0 in labor. Which one would be most appropriate for a prima gravida as she completes the early phase of labor? I'm just kidding. I'm not gonna do you like that. Have to go keep up the. Hey, Jay, I appreciate you, man. You have a good rest of your evening, man. Is it A, impaired gas exchange related to hyperventilation, alteration in a placental perfusion related to maternal position, impaired physical mobility related to a fetal monitoring equipment, or D, potential fluid volume deficit related to decreased fluid intake? What are we thinking? Bella, he wasn't talking to you. He was talking to me. God. I always got to make it about you. Lord of mercy. All right, so Savannah says A. Okay. Ty says B. Okay. Rach says A. Okay. Arlene says A. Jessica says C. Lorna says B. Okay. Audrey. All right. I really don't know this one for. Okay, Bella. Hey, if you don't know it, hey, give me an answer, though. Give me an answer. So remember, apply what you know versus trying to apply what you don't know. Like apply what you know of what you know in regards to labor and delivery. All right. All right, here we go, y'all. Here's our answer in 3, 2. And the answer is D, potential fluid volume deficit related to decreased fluid intake. Clients admitted in labor are told not to eat during labor to avoid nausea and vomiting. Ice chips may be allowed, but this amount of fluid might not be sufficient to prevent fluid volume deficit. Provide clear fluids and ice chips as permitted. Helps promote hydration and may provide some calories for energy production. Physiological integrity. Third largest section on the NCLEX, 11 to 17%. All right. This is the right time to get this wrong. Don't be shy. That's what I'm trying to tell y'all. If you get it wrong, it's okay. Like, who's going to judge you? I'm not going to. Well, I might. It depends on who you are. But the majority of y'all, like 99% of y'all, I'm not going to judge y'all because, you're learning. Some of y'all just need to all right, here we go. Question 13. As the client reaches 8 centimeters dilation, the nurse notes late decelerations on the fetal monitor. The fetal heart rate baseline is 165 to 175 with a variability of 0 to 2 beats per minute. What is the most likely explanation of this pattern? The baby is asleep. The umbilical cord is compressed. There is a vagal response. There is uteroplacental insufficiency. What are we thinking? What are we thinking? I feel like I should have got this because I complain about not eating during when I was in labor. Look, hey, see, sometimes you can apply, your own personal experiences as well. You're like, damn, bro, why ain't they letting me eat? Oh, because you don't want me to throw up? Oh, okay, cool. That makes sense. All right, what are we thinking? 15 seconds, y'all. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Free sets of questions. Go over there and check those out for yourself. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Make sure you guys share. Make sure you guys follow and smash that like button. Hey, we need 20,000 likes. We need 20,000 likes. Hey, who am I about to pick next to get me some likes? Who am I going to pick? I'm going to pick the first person I see in front of me. Bella. Nope, never mind. I don't want you. Rach. Oh, man. Rach, go ahead and do it. Make it happen. Veal chop. There you go. There you go. All right, y'all. Here's our answer. Here is our answer in 3, 2. And the answer is D. There is uteroplacental insufficiency. This information indicates a late deceleration, right? This type of deceleration is caused by uteroplacental lack of oxygen. All right. Physiological integrity. Third largest section on the NCLEX at 11 to 17%. All right. 11 to 17%. Don't forget that. All right. You'd be very surprised when you're reading a question. You'll be like, oh, I know what kind of question this is, especially if I throw out a management of care type of question. Right. Here we go. Question number 14. The nurse notes variable decelerations on the fetal monitor strip. The most appropriate initial keyword is initial. Initial. Right. The most appropriate initial action would be to what? Notify her doctor, start an IV, reposition the client, or readjust the monitor. What are we thinking? You have bad signal. Hey, Rach, you ain't gotta lie to kick it. All right. You ain't gotta lie to do all that. If you don't want to give me likes, just say that. And I'll just, that's fine. I'll just make Nurse Katie do it. All right, y'all, 10 seconds. Hey, if you guys are new here, I want to know who you are, where you're from, and where you're at in your nursing journey. I put a lot of likes and love. Nah, Rach, I got you. I'm just messing. All right, y'all. Hey, I'm going to do an Ask Me Anything after this. So if I got any new people, got any questions about anything, I will most definitely answer them to the best of my abilities. The first thing to consider, here we go. And the answer is C, reposition the client. The initial action by the nurse observing a late deceleration should turn the client to the side, preferably the left side. Administering oxygen is also indicated. Initial management of recurrent variable decelerations should have a target of relieving potential core compression. Maternal repositioning is a reasonable first maneuver. Variable decelerations can be seen resulting from fetal movement if the fetus is premature. Physiological integrity, third largest section on the NCLEX at 11 to 17%. And my veal chop notes with, hey, I'm trying to tell you, hey, that's the reason why veal chop is a universal thing. You know what I'm saying? Every school, every freaking review, they have it. They have it in there. All right. I have it in my lectures too. Here we go. Question 15. Which of the following is a characteristic of a reassuring fetal heart rate pattern? All right. A fetal heart rate of 170 to 180, a baseline variability of 25 to 35, an ominous periodic changes, or is it acceleration of fetal heart rate with fetal movement? What are we thinking? What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Is this all L&D? I think so. We're at 15. So pretty much it has been L&D for the most part. I'm going to be working on getting some cardiac and some more pharm and some neuro and some stuff like that. Because I know everybody's like, can we do another one? And I'm just like, one day. All right, we got D. You love labor and delivery. I don't. That's just not, I'm not a fan of that part of nursing, like at all. I mean, I know it got to be done, you know what I'm saying? Because, when you got kids, what do you do? Here we go, y'all. Here's our answer in 3, 2. And the answer is D, accelerations of fetal heart rate with fetal movement. Accelerations with movement are normal, right? I would expect, just like you, like if you're sitting down, your heart rate's going to be like at, 70 or 80. And then you get up, I fully expect for your heart rate to, to jump up. You know what I mean? So that I don't sound so childish. What you mean? What you mean, bro? What you mean? All right. Physiological integrity. Third largest section on the NCLEX exam, 11 to 17%. All right. Hey, real quick. Don't y'all go nowhere. Commercial break. Hey, we're doing NCLEX questions for RNs and LPNs. Got them off nurseslabs.com. Make sure you guys go over there and check those out. Participate. All right. Hey, smash that like button. Make sure you guys share. Make sure you guys follow. But of course, participate. Answer the questions. Hey, if you don't want me to do, if you don't find this valuable, you know what I'm saying, I won't do it no more. You know what I'm saying? Got to go. See you. Okay. All right, Cass. Also, you come into my chat and you act a fool, I'm gonna ban you. So don't be rude, all right? Also, 7-day NCLEX course, private tutoring call, NCLEX coaching, the NCLEX Victory Guide ebook, free download, all there at the website. All those links are also in my bio as well. I'm going to do an Ask Me Anything after this. So just passed my local boards here in the Philippines. John, congratulations to you, sir. Congratulations to you. Everybody give John his, hey, that's just one step closer. John, are you trying to come to the States? Are you trying to come to the States? Hey, but regardless, sir, that is one step closer. Congratulations to you on passing your boards, all right? I know you're going to go out there and you're going to be a great nurse. Yeah, there you go. Here we go. Question number 16, the rationale for inserting a French catheter every hour for the client with epidural anesthesia is what? The bladder fills more rapidly because of the medication used for the epidural. Her level of consciousness is such that she is in a trance-like state. The sensation of the bladder filling is diminished or lost, or she is embarrassed to ask for the bedpan that frequently. What are we thinking? Shout out to all 42 of y'all. Can't wait until this term is over. Oh, hey, is it Shondell? Look, hey, that's right around the corner. Ooh, what is this? Are you the top 1% in the Philippines 2023? Hey, look, hey, y'all gonna make it work. Y'all gonna make it work. You know what I'm saying? Hey, I'm telling you right now, the path to conquering the NCLEX belongs, it starts with you. All right. I don't care what any of those damn teachers tell you. They have this whole, fright factor that they like to do to people. And let me tell you something, go out there and fucking conquer that NCLEX. You know what I'm saying? But hey, the only person to blame if you don't pass it is you. I'm letting y'all know that, hey, I failed the NCLEX 3 times, y'all. 3 times. All right. And I came back swinging on the 4th time, passed it with it felt like flying colors. All right. So don't let people deter y'all and don't let people be negative. Keep all those negative fucking people out of your face. All right. Here we go. And the answer is C. The sensation of the bladder filling is diminished or lost. Epidural anesthesia decreases the urge to void and sensation of a full bladder. There it is. Physiological integrity, 3rd largest section on the NCLEX exam at 11 to 17%. We have a lot of physiological integrity. By the way, they kind of mix questions on NCLEX as well. So you'll see physiological adaptation along with some type of management of care. All right, here we go. Question number 17. A client in the family planning clinic asked the nurse about the most likely time for her to conceive. The nurse explains that conception is most likely to occur when estrogen levels are low. Is it a luteinizing hormone is high? The endometrial lining is thin. The progesterone level is low. What are we thinking? Any select all that apply? I don't know, Kay. It depends. When they pop up. It depends on when they pop up. I had a bunch of select all that apply on Friday. I had a bunch of select all that apply on last Wednesday or Tuesday, something like that. So it all just depends. A lot of people ask if the new gens are in here. I'm working on getting new gens in PowerPoint so I can do it this way, but the font is so small. I would have to do the case study on one sheet and then go to the answers on the next one. But hey, we'll make that work. All right. Here we go, y'all. Here's our answer in 3, 2. You're welcome, Kay. And the answer is B. Luteinizing hormone is high. Luteinizing hormone released by the pituitary is responsible for ovulation. All right. Health promotions and maintenance, which is 9 to 15% on the NCLEX. A smaller section, but still very important. All right. All eight client needs of the NCLEX test plan are important. All right. I'm just letting you guys know what are the sizes of the big 3. All right. Here we go. Question number 18. The client tells the nurse that she plans to use the rhythm method of birth control. The nurse is aware that the success of the rhythm method depends on the what? Is it age of the client, frequency of intercourse, regularity of the menses, or range of the client's temperature? What are we thinking? It says, just learned that at AMP2. Shot what? Oh, okay. I see you, Shondell. All right, cool. Hey, don't be forgetting those either. Don't be forgetting those. All right. Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Nurseslabs.com. All right. Free sets of questions. By the way, if you are a new nursing student, they have nursing care plans, NANDAs. They have these questions. They got all kind of stuff for y'all. Free sets of stuff. Go over there and check those out for yourself. Also, if you guys are new here, make sure you guys smash the like button. Make sure you guys share and make sure you guys follow. All right. That is the trifecta that TikTok needs. Hey, get carpal tunnel for me and stop playing games. All right. Make it happen. Also, I want to know who you are, where you're from, and where you are at in your nursing journey. All right, y'all. All right, y'all. Here we go. Here is our answer. Here is our answer in 3, 2. And the answer is C, regularity of the menses. The success of the rhythm method of birth control is dependent on the client's menses being regular. Women are only fertile for a few days each month. Yes. I mean, women using the rhythm method monitor their body and analyze their past menstrual cycles to try to determine when their fertile days are. That is health promotions and maintenance. I just sent so many likes. Bella, I don't even believe you. What do you mean? I can literally see who's giving me the most likes, and it literally says you gave me like 4. I heard that, yes, and it's not happening again. Bella, come on. That's not what I meant. Oh, man. Can never do anything around here. Here we go. Question 19. A client with diabetes asked the nurse for advice regarding methods of birth control. Which method of birth control is most suitable for the client with diabetes? All right. Is it the intrauterine device? Is it oral contraceptives, diaphragms, or contraceptive sponge? What are we thinking? What are we thinking? What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Free sets of questions. So make sure you guys go over there and check those out. Smash that like button. Make sure you guys share. Make sure you guys follow. Hey, so a little bit about me for those that don't know. Been a nurse for 3.5 years. I worked in ICU. I worked PACU and I worked OR. I've also been in the Navy for 16 years. So now I'm on the downward slope of that. So I've been deployed twice. I've been a surgical technology instructor. I'm a trauma nurse instructor as well. I've been an instructor for multiple other types of courses. So been teaching for a while, going back to school, get my master's in nursing education. So, this is what I like. This is what I like. All right. So this is why I like doing for y'all. This is why I got all those stuffs over there. I might be thinking too deep. Yeah. Don't hurt yourself now. Don't hurt yourself. If you start thinking too much, Bella, you'll get yourself a migraine. We talked about that. All right. Anticoagulant. Thank you for, I appreciate your support. Bree says C. Jessica says, I'm going to say C because all right, here's our answer in 3, 2, and the answer is C, diaphragm. The best method of birth control for a client with diabetes is the diaphragm. The diaphragm is a birth control device that prevents sperm from entering the uterus. The diaphragm is a small, reusable rubber or silicone cup with a flexible rim that covers the cervix. Before sex, the diaphragm is inserted deep into the vagina so that part of the rim fits snugly behind the pelvic bone. The diaphragm is effective at preventing pregnancy only when used with spermicide. That is part of health promotions and maintenance, right? Why be mad? Yeah, less invasive, Bree, for real, right? Less invasive. You're so mad? Ugh, I don't know why. I don't even know why. Here we go. On to the next one. Hey, question number 20. Yeah, he says, I'll be thinking too deep. Yeah, that's exactly like what it said. Exactly like what it said. You know what I mean? Here we go. Question 20. The doctor suspects that the client has an ectopic pregnancy, right? Which symptom is consistent with a diagnosis of ectopic pregnancy? Is it painless vaginal bleeding, abdominal cramping, throbbing pain in the upper quadrant, or sudden stabbing pain in the lower quadrant? What are we thinking? Shout out to all 40 of y'all that are in here rocking with me. We are doing NCLEX questions. Today is Monday. Hopefully everybody had a good weekend. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Hey, give me the 20,000 likes, y'all. Give me the 20,000 likes. Get carpal tunnel for me. Get carpal tunnel from me right now. I would do it for y'all. And if you start getting cramps in your fingers, just start tapping with your toes. All right. All right. Also, hey, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. What brings you here? What brings you here? Also, if you're not a nurse or on that journey as a nurse, what you do? Changing answer to B. Hey, you already know my deal, Shondell. Hey, you have to be able to 100% articulate to me why you're changing the answer. Okay. Because 9 times out of 10, your first answer is the correct answer. I'm not saying that your answer was correct or incorrect. I'm just letting you got to get into that mindset, okay? Here we go. Here's our answer in 3, 2. And the answer is, look at that. Just passed my NCLEX on Friday. Shout out to you, Bree. That's what I'm talking about. Shout out to you, Bree. First of all, hey, everybody right now, while y'all are answering, y'all need to give her love right now. All right. Hey, congratulations. You already know the deal. Welcome to the greatest shit show on earth known as nursing. Hey, which one did you take? RN or LPN? And if you could give one thing of advice to everybody in the chat, what would that be towards conquering your NCLEX? All right. And of course, it's D, sudden stabbing pain in the lower quadrant. The signs of an ectopic pregnancy are vague until the fallopian tubes rupture. Right. So just like whoever said, I think it was Kay who had said something about the fallopian tubes. Okay. Now I just sent a lot of likes. Okay, cool. You sent a lot of likes because you got it right. What the hell? That's what I'm talking about. Hey, that makes me happy. You read the fucking question? Bree, that's what I'm talking. Hey, that makes me happy. That makes me happy. Physiological integrity. All right. Third largest section on the NCLEX. Okay. At 11 to 17%. Hey, I'm not even gonna lie. That really makes me happy that she said RTFQ. So that's your advice, Bree, is RTFQ. Hey, we're doing NCLEX questions for RNs and LPNs. Make sure you guys participate. Bree, y'all just passed her NCLEX. You know what I'm saying? If you guys are new here, Bree out here, doing her thing, about to go out there. Hey, what type of nurse are you going to be? Let us know, because now I'm getting all nosy and getting all up in your business, right? Hey, make sure you guys share, follow, and give me all those likes. Don't be selfish your whole life. Hey, also, don't troll my chat. You troll my chat, I'm going to ban that ass, okay? Nurseslabs.com is where I got these questions. 7-day NCLEX course, private tutoring, NCLEX coaching, ebook, all that good stuff is in the link in my bio right there. All right, and I'm going to do Ask Me Anything to follow after this. LVN, that's okay. You want to know why? Hey, you could be an LVN for the rest of your life if you wanted to, and that is okay. All right. Don't let nobody fucking pressure you and tell you that you have to do something you don't want to do. Now, if you want to go RN, FNP, all that stuff, girl, go do you. Question 21. The nurse is teaching a pregnant client about nutritional needs during pregnancy. Which menu selection will best meet the nutritional needs of the pregnant client? Is it hamburger patty, green beans, French fries, and iced tea, roast beef sandwich, potato chips, baked beans, and a cola? Who says cola? Baked chicken, fruit cup, potato salad, coleslaw, yogurt, and iced tea, as long as the coleslaw don't got no raisins in it, or a fish sandwich, gelatin with fruit, and coffee. It says girl at all because I'm an LP, and that's what I'm talking about. I'm telling y'all right now, all of them sound good, right? Except for that potato salad. I'm trying to put raisins in it. Bella, you put raisins in your potato salad, don't you? I knew it. 10 seconds, y'all. 10 seconds. RN graduation next week, though. That's what I'm talking about, Bella. You already know the deal. And when you pass NCLEX, you already know you better come over here. You better say something. You already know you better give me a video testimony review for all the nonsense that you done caused me. All right, here we go. Here's our answer in 3, 2. And the answer is C. Baked chicken, fruit cup, potato salad minus raisins, coleslaw, yogurt, and iced tea. All of the choices are tasty, just like Bella said. But the pregnant client needs a diet that is balanced and has increased amounts of calcium. That is health promotions and maintenance, which is at 9 to 15% on the NCLEX exam. All right, here we go. On to question number 22. The client with hyperemesis gravidarum is at risk for developing what? Respiratory alkalosis without dehydration, metabolic acidosis with dehydration, respiratory acidosis without dehydration, or metabolic alkalosis with dehydration. Exactly why I've never been pregnant yet. That's all sounds good. Stop it. I know that one. Oh, you. Hyperemesis gravidarum. All right, what are we thinking? Shout out to all 42 of y'all. Hey, we're on the road to 20,000 likes. Hey, I need 20,000 likes, y'all. Just smash the like button, all right? Just smash the like button. Hey, by the way, y'all. I'm 3 videos. 3 videos are getting edited. 5 videos are getting edited for the 7-day NCLEX review to include pharmacology, physiological adaptation, and management of care. I'm just letting y'all know those are going to be up. Those are going to be up here within the next week or so. All right, I'm just letting y'all know that right now. All right. So for all the people that bought the course, hey, it's coming. My sister is going through this now. Hey, what? She got hyperemesis gravidarum throwing up everywhere? Here we go, y'all. Here's our answer in 3, 2. And the answer is B. Metabolic acidosis with dehydration. Hold up. The client with hyperemesis has persistent nausea and vomiting, right? With vomiting comes dehydration. When the client is dehydrated, she will have acidosis. In severe cases of hyperemesis, complications include vitamin deficiency, dehydration, and malnutrition. If not treated appropriately, Wernicke's encephalopathy caused by vitamin B deficiency can lead to death and permanent disability if it goes untreated. Right. I don't really like this question at all. But yeah, the dehydration is most definitely acidosis, but the hyperemesis is not. This is one of those questions. Yeah, I know. I don't like. I just look. I don't like them either. I don't like them either. Right. But then you want to know why I like getting questions that are like this. Like I used to get mad. I was just like, bro, who wrote this question? Where'd you get it from? Right. But now, if I see this question again or anything related to it, literally, I'm going to be like, all right, I remember something that was exactly kind of like that. Right. And he said, no, this question going to track. Hey, look, Brish. Look. I don't disagree with you. I don't disagree with you. But. And there is a but, like a huge BBL. You got to be aware that some of those questions are going to be written like that, and you're going to have questions that are going to be wrong. All right. So, but I always remember the Mark Clemick way. The rules of the bees. Or if it's not lung or vomiting and suctioning, the default answer is metabolic acidosis. So, vomiting and suctioning. Hyperemesis gravidarum. It's right off the bat. I'm thinking metabolic alkalosis. Right. That's what I'm thinking. All right. Here we go. Question number 23. A client tells the doctor that she is about 20 weeks pregnant. The most definitive sign of pregnancy is what? Elevated human, what is the HCG? The presence of the fetal heart tone, uterine enlargement, or breast enlargement and tenderness. What would I say? Oh, I did see BBL, didn't I? My bad. Because a big old butt. All right, y'all. Hey, if you guys are new here, welcome. Hey, 20,000 likes. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. Also, if you guys want to fight whoever wrote these questions, you guys can go to nurseslabs.com. These are free sets of questions. You guys can go over there and check those out for yourself. This is why I say it's very important that you have your your content, you have your question and your answers, you read your rationales, and then if you still don't understand something or you don't like it, do the research. Do the research for it. All right. That's all I'm saying. But if I was to ask you 100 questions, you can expect 5 to 10 of them to possibly be wrong, but that does not negate the fact that you fail any type of question. All right. Second term pregnant. Okay. Shout out to you. Okay. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is B, the presence of fetal heart tones. The most definitive diagnosis of pregnancy is the presence of the fetal heart tone, right? Don't be walking around being like, yo, I'm kind of pregnant. I remember I was in high school. A girl said that. I'm kind of pregnant. I'm like, how the fuck are you kind of pregnant? Hey, people, hey, you know who you are. And if you said it, you ain't shit. I'm just letting y'all know that right now. Okay. So don't do that. All right. Health promotions and maintenance, 9 to 15% on the NCLEX exam. All right. Don't be coming to hollering. Look. Don't be coming out here saying I'm kind of pregnant. It's either you are or you aren't. Okay. Lord have mercy. Question 24. The nurse is caring for a neonate whose mother is diabetic. Right. The nurse will expect the neonate to be what? Hypoglycemic, small for gestational age. Hyperglycemic, large for gestational age. Hypoglycemic, large for gestational age. Or hyperglycemic, small for gestational age. Man, the accuracy in high school. Look, I can reminisce right now and tell you High school was great. High school was great for me. It was amazing. Amazing. All right, y'all. Hey, you know what? Everybody put what the year they graduated right now in the chat. I graduated in 2006. I'm just letting y'all know that right now. You know what I'm saying? I don't care what y'all say. I'm gonna come over here talking about me. All right. I love y'all. 2011. Good God, Bella. Oh my God. All right, y'all. Here's our answer. High school graduation. Class of 2013. All right, Bree. 2021. Good God. Oh my Lord of mercy. Hey, I did it to myself. Your birthday is next week. Oh my God. I just turned 36 in October, so now I'm just like, now I'm falling apart. And the answer is hypoglycemic, large for gestational age. The infant of a diabetic mother is usually larger for gestational age. After birth, glucose levels fall rapidly due to the absence of glucose from the mother. Hypoglycemia is caused by hyperinsulinemia due to the hyperplasia of fetal pancreatic beta cells consequent to maternal fetal hyperglycemia. Ooh, boy, that's a mouthful. Physiological adaptation, third largest section on the NCLEX. 1989, Shondell, look, let me tell you something. I was born in 1987. You know what I'm saying? I don't know how that makes y'all feel. On to the next question. Here we go. Question number 25. Which of the following instruction should be included in the nurse's teaching regarding oral contraception, right? Is it weight gain? Should be reported to the physician. An alternate method of birth control is needed when taking antibiotics. If the client misses one or more pill, 2 pills should be taken a day for a week, or changes in the menstrual flow should be reported to the physician. What are we thinking? So I graduated December 13th and my birthday is on the 14th. Look, hey, that's a good graduation present. That's a good graduation present. That's and a testament to your journey of, getting through nursing school, or your second part of nursing school, aka, getting your RN. So, all right, y'all, what are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. Got them off nurseslabs.com. Free sets of questions. Go over there and check those out for yourself. Smash that like button. Make sure you guys share. Make sure you guys follow. Y'all being real greedy. Y'all being real greedy over there. Real greedy. Get carpal tunnel for me. You know what I'm saying? Get it. Make it happen right now. Hey, anybody watch that Grand Theft Auto 6 trailer? Me? Just me? Okay. I guess I'm just a nerd and I just like video games. All right, whatever. All right, y'all, here's our answer. Here is our answer in 3, 2. And the answer is B. An alternate method of birth control is needed when taking antibiotics. When the client is taking an oral contraceptive and begins antibiotics, another method of birth control should be used. Antibiotics decrease the effectiveness of oral contraceptives. Antibiotics are suspected to diminish oral contraceptives' efficacy by 2 main mechanisms. Was it induction of the cytochrome, a P450 group of hepatic microsomal enzymes, and interference of the enterohepatic cycle of that. I'm not even gonna say that word, but you already know what it is because I will totally mess it up. Hey, I could literally antibiotics. Look, this is why I said high school was wild for me. Health promotions and maintenance. All right, health promotions and maintenance 9 to 17%. All right, hey, real quick. Hey, we're doing NCLEX questions. Got them off nurseslabs.com. Say, smash that like button, y'all. Hey, we less than 2,000 likes, y'all. Less than 2,000 likes to get us to 20,000 likes. Make it happen. All right, share, follow, give me those likes. Get it out to people. If you're in nursing school right now, send it to your cohort. All right, stop being selfish. Hey, if you troll, I'm gonna ban that ass. All right, so don't be rude. Also, nurseslabs.com, once again, is where I got these questions from. All right. NCLEX, 7-day NCLEX course, $97. All right. $97, and you get it for a lifetime. Make sure you guys go over there. All those links are in my bio. Looking for one-on-one coaching for NCLEX, or if you want to just get on a call with me and, chop it up for an hour or so, we can do that. That link is also in my bio. It says I'm coming for a one-on-one tutoring for Look, ma'am, you already know what the deal is. You already know what the deal. I'm going to call you. Look. Shh, don't be over there acting a fool now. I'll block you on here and I'll block you on the phone. Don't play with me. Here we go. Question 26. The nurse is discussing breastfeeding with a postpartum client. Breastfeeding is contraindicated in the postpartum client with diabetes, positive HIV, hypertension, or thyroid disease. All right, what are we thinking? Shout out to all 45 of y'all up in here rocking with me. You know what I'm saying? 45 folks up in here. I used to teach in like big rooms that had like 100 plus people in 100 Navy sailors, Army soldiers, and Air Force like airmen. Like I used to teach in front of them all the time. So for the fact that I got 45 people up in here listening to me run my mouth, look, you already know the deal. See, man, I'm rocking and you playing me. Look, first of all, ma'am, you already know what the deal is. You already know. Bella, imagine if we got on the phone. All right. You gonna be good to go out here. You already know the deal. Is it Rakisha? Rakisha says B. Cass says B. Is it Chachu? Chachu. Like cha-cha-chu. Says B. All right, cool. I am, is it Nana Ama? All right, says B. Andy says B. All right, y'all, here we go. That just boosts my confidence. Thank you. You're welcome. Hey, you already know what the deal is. I got you. Here we go. Answer in 3, 2. And the answer is B. Positive HIV or H4. Client with HIV should not breastfeed because the infection can be transmitted to the baby through breast milk. That is health promotions and maintenance. Hey, here's a story for y'all real quick. When I was in clinicals, literally the nurse that was on night shift put in the patient's chart that the patient has H5, like wrote out H, like put the letter H and then put the number 5. And we're like, what the hell is that? And next thing you know, we called him and we were just like, hey, bro, like, what is H5? He was like, yeah, H5. And he's like, what the hell is that? And he's just like, H with the Roman numeral 5. And we were like, the Roman numeral 5? Bro, do you mean HIV? Hey, this is a nurse, by the way. I'm just saying. Anyways, question 27. A client is admitted to the labor and delivery unit complaining of vaginal bleeding with very little discomfort. The nurse's first action should be to what? Assess the fetal heart tone, check for cervical dilation, check for firmness of the uterus, or obtain a detailed history. Hey, I'm trying to tell you, Cass, it was wild. I looked at the nurse that I was with on clinicals. She had been a nurse, I think, for like 6 years at that point. And she looked at me. She was just like, hey, Don't ever fucking do that. And I was just like, bro, like he really wrote that? And she's just like, yes. I'm like, oh, that's wild. Yo, so hey, remember that charting is a piece of legal documentation, all right? Don't be that person. If they audit your fucking charting, they're coming back looking for you and be like, hey, so explain H5 to me. All right, here we go, y'all. Here's our answer. Everybody's screaming A, but here's our answer. Let's check it out in 3, 2. And the answer, of course, is A. Assess the fetal heart tones. The symptoms of painless vaginal bleeding are consistent with placental previa. All right. Assess the fetal heart sound so the mom would be aware of the health of her baby. All right. That is physiological integrity, which is the third largest section on the NCLEX at 11 to 17%. All right. Hey, it looks like we're going nothing but maternal for this one. All right. Here we go. Question number 28. A client telephones the emergency room stating that she thinks that she is in labor. The nurse should tell the client that labor has probably begun when what? Her contractions are 2 minutes apart. She has back pain and a bloody discharge. She experiences abdominal pain and frequent urination, or has contractions that are 5 minutes apart. What are we thinking? Hey, look. Hey, we almost to 20,000 likes. You know what I'm saying? Stop playing games with me, all right? Make it happen. Get carpal tunnel for me. I don't care if you got to tap it. I don't care if you got to bend over and tap it with your toes. Breathe through your nose and then say, oh my God. All right, here we go. Oh my God, I'm a fool, y'all. I'm a fool. It's Monday. Hey, if you guys are new here, welcome. Hey, I want to know who you are, where you're from, and where you're at in your nursing journey. All right, anybody a Kevin Gates fan? Oh my God, here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is D. Her contractions are 5 minutes apart. The client should be advised to come to labor and delivery unit when the contractions are every 5 minutes apart and consistent. She should also be told to report to the hospital if she experiences rupture of membrane or extreme bleeding. True labor consists of contractions at regular intervals. As labor progresses, these contractions become stronger and the time between each contraction decreases. That is physiological integrity. All right. Oh no, I changed my answer. Hey, is it Marilyn? First of all, good name. Y'all let Marilyn know. Marilyn, I haven't seen you before for some reason. Your name looks new. So I'm going to need for y'all to let Marilyn know what is the group motto when it comes to changing our answers. The answer, y'all let her know. All right. Physiological integrity, 11 to 17% on the NCLEX. All right. 11 to 7% on the NCLEX. All right. Here we go. Question number 29. Sorry if you guys hear my son, he's screaming. He's doing this thing. Don't change your answer. Yeah, don't change. Hey, in RTFQ, read the fucking question. You know what I'm saying? Hey, if you guys don't like the F word, then you might as well not even be a nurse, because a nurse's favorite word is the F word. I swear when I was working in the ICU, it was like being on deployment sometimes, where hearing women just say the F word. It was the most glorious thing I ever heard in my life. Here we go. Question 29. The nurse is teaching a group of prenatal clients about the effects of cigarette smoke on fetal development. Which characteristic is associated with babies born to mothers who smoke during pregnancy? Is it low body weight, large for gestational age, preterm birth but appropriate size for gestation, or growth retardation in weight and length? Nia, where you been at, girl? Good, look, you already know the y'all. You better RTFQ it. You better RTFQ that motherfucker. All right, what are we thinking? Nadia says A. Coco says C. Marilyn says, all right, Marilyn, redeem yourself. Redeem yourself now. Redeem yourself. Let's see what the deal is. Merlio. It reminds me of holes. What's Merlot? All right, y'all. 10 seconds. A or D. Hey, you got to give me one. Chacho says A. Pretty says C. A. Okay. Shanika says A. All right, here we go, y'all. Here's our answer in 3, 2. Rach, I didn't even know you left, to be honest, but I appreciate you coming back. And the answer is A, low birth weight. Infants of mothers who smoke are often low in birth weight. Smoking during pregnancy increases the risk of health problems for developing babies, including premature birth, low birth weight, and birth defects of the mouth and lips. Smoking during and after pregnancy also increases the risk of SIDS, right? Health promotions and maintenance, 9 to 15% on the ink. That's what I'm talking about, Marilyn Marilo. Got that answer right. That's what I'm talking about. Redeeming yourself, because you want to know why you don't change your answer unless you can articulate it to me 100% and you read the fucking question. That's what I'm talking about. Question number 30. The physician has ordered an injection of Rogaine for the postpartum client whose blood type is A negative, but whose baby is O positive. To provide postpartum prophylaxis, Rogaine should be administered when? Within 72 hours of delivery, within a week of delivery, 2 weeks of delivery, or a month of delivery. What are we thinking? What are we thinking? And shout out to y'all getting me to 20,000 likes. You know what that tells me? Y'all ain't greedy. Y'all love me. Y'all love me being here, at least doing something, you know what I mean? So Nia says 72 hours. Okay. All right. Hey, if you guys are new here, I want to know who you are. Where I know who some of you are now, but who are you? Where are you from? Where are you at in your nursing journey? All right. And if you're not a nurse, what you doing here hanging out with us? Lou says A. Rach says A. Okay, I'm gonna give y'all 10 seconds. Rach, I seen you. Rach, you spamming me now. I took the injection person. What you mean? Oh. Oh my God. Oh, while pregnant, 26 weeks. That's to provide prophylaxis. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2. Ohio getting ready for the NCLEX next month. That's what I'm talking about. Here we go. And the answer is, of course, 72 hours of delivery. Well, within. To provide protection against antibody production, Rogaine should be given within 72 hours. One dose of Rogaine is usually given around 28 or week 28 of pregnancy and last about 12 weeks. If the fetus is Rh positive, the mother will also be given Rogaine within 72 hours of birth. The baby's blood type can be determined easily after birth from cord blood samples. All right. Yeah. So that was the answer to your question. A lot of times I won't answer y'all's question because I purposely say, go read your rationale. All right. Because by reading your rationale, you personally reading it, it allows for it to solidify in your brain as you are studying. Right. That's why I didn't answer it yet. Oh, okay. Yeah, well, that taught me something. See, hey, as long as you were learning something, that's all I care about. All right, here we go. Hey, ladies and gentlemen, that is a wrap for the questions today. Hey, we right at an hour, y'all. Right at an hour. All right. Hey, I appreciate all of y'all rocking with me. Hey, I'm about to turn this camera around here in a second. All right. So y'all can ask me these questions, you know what I'm saying? But I appreciate everybody participating. I love that you guys came here for I think I had 45 of y'all in here. Hey, if this was 45 of y'all in a room of me actively teaching y'all, it would be wild. Let me tell you. All right. Hey, I didn't have to ban nobody. I wish I could have. I was trying to be petty, but you know the deal. Nurseslab.com is where I got these questions from. 7-day NCLEX course, lifetime access, y'all. $97. $97. Go over there and check it out. And you get access to the course for a lifetime, all the updates. You also get access to the Facebook group, all that good jazz. All right. Also, got a freebie over there for you guys. You guys go over there, check that out. Coaching, tutoring, all those links are in my bio. But real quick, I want to show y'all something. I'm going to show y'all. Hey, this is what the website looks like, y'all. Y'all can go over there and check that out. Y'all can go over there and check that out. And then, of course, like I said, once you scroll down to the bottom, like you said, you get it. It's normally, when it comes back, it's going to go to $347, y'all, for $97. Like I said, you get lifetime access. You get a review. You get essentially 2 reviews. Eventually, over 100 content videos. You get access to a Facebook group. We get monthly content updates. You get the free updates. And, of course, this is for RNs and LPNs. All right. More farm questions or more farm. I got you. We're going to see what's up. Bella says, thank you so much. Hey, Bella, you already know the deal. All right. Hey, once inside, this is what it looks like, y'all. Over here, I already got the new generation NCLEX review up right here. Right here, y'all. And also, here's content, right? To prepare you for NCLEX, time management, labs, legal, right? Collaborative stuff, delegation, restraints, how to create a study plan for yourself. Hey, and who said something about farm? Rach, you said something about farm, right? There are 18 videos right here. 18 videos for pharmacology inside this course, right? And then, of course, I have a fluid and electrolyte imbalance section. I'm working on cardiology. Right now, we're going to be talking about, VTAC versus VFib, AFib versus AFlutter, torsats. Like, I'm sepsis, myocardial infarction. Like, I'm working on a bunch of lecture videos. And then, of course, we have our endocrine section right here, right? Where we talk about DKA, hypoglycemia, DI versus SIADH, all that good jazz. All right. And another thing I want to show you guys. So this is what the private coaching one looks like. This is what it looks like. Hey, look at that picture, though. That's a fancy dude right there. You see what I'm saying? Fancy dude. Look. Hey, look. Fancy dude. Hey, look. You get a Zoom call. You know what I'm saying? We talk about, somebody, Bella has always been asking about this. ATI, HESI, NCLEX. Do I tutor for that? Of course I can. And if you're a nursing student, do I tutor that? Yeah, absolutely. And of course, you got the private tutoring. We talk about mentorship and career guidance and all that other good jazz, right? And then also, yo, look, I got an ebook. I made this ebook because somebody was like, "Can you make an ebook?" I was like, "Bro, I got you." The ebook. You can check all that stuff out in the link in my bio. This is $29. $29, and it comes with over 700 pages. 700 pages, y'all. Like, not even playing. All right. So y'all make sure y'all go over there and you guys check out all of that. Hey, y'all check out my fanny pack though. Like, look at that. Fanny pack. Fanny pack. Not even gonna lie. Once I got one, it was the most glorious thing on earth. Not even gonna lie to y'all. Yo, what is the deal? Hey, I'm tired, y'all. How y'all doing? How are y'all doing? Hey, peep the shirt. Peep the shirt. You know what I'm saying? Black Panther, like comic book style, baby, because that's how we do. Hey, how y'all doing? How are y'all doing? Welcome, welcome. Appreciate all 22 of you guys still rocking here with me. If you guys are new here, my name's Kevin. I go by the Boot Nurse on all social media platforms. You guys can go over there to check that out. Instagram, I got a Facebook page, YouTube. By the way, any lives that you come to or that you miss, those lives will go up on YouTube. So if you miss anything, you guys can go over there and check those out as well. All right. I've been in the Navy for 16 years. I've been a nurse for 3.5. I've worked in 3 different ICUs. A burn ICU, a neuro, and a medical ICU. I've worked in the PACU, and as well as I've worked in the operating room. My favorite area out of all of those was the PACU, but I love the knowledge that I got when I was in ICU. So I have access to ATI already, but haven't gone through it yet. When should I start doing it? You're talking about like ATI for NCLEX? It depends on when you're graduating. I'm waiting for a call back for a job in the ICU. Shout out to you. Go ahead. Hey, Bella, you already know the deal. You've been a nurse for a while. Don't let these people play with you. Don't let these people play with you, because trust me, as they play with you, they will toss you the fuck away and get other people in there to replace you just as fast. You already know the deal. But what questions do you guys have? And until you guys, I guess I'll just run my mouth until that. Y'all, I failed my NCLEX 3 times. 3. Listen, ATI is difficult. I'm not going to lie. So here's the thing about, who is it? Shondell, when you ask, depends on when you graduate. I would say, start now. Like, start now by at least being familiar with it. I'm not graduating until next December, but my school already gave us access. Okay. So there's nothing wrong with opening it up and just kind of like just getting familiar with what the questions look like. But you don't graduate till next December. You really, really, really want to start studying like hardcore probably in November, because if you think about it, around Black Friday, Thanksgiving time, that's already like a week or 2 left of November. Then you got all of December, so that gives you about another month. So about anywhere from 4 to 6 weeks right there. And then you're going to be waiting for your authorization to test, which could take anywhere from 2 to 4 weeks for you to get after that. So you probably won't be taking your NCLEX. Maybe at the latest would be like end of January. But I think you would probably end up taking like the beginning of January. I would definitely start studying like hard, like dedicated studying would be like in November. But you can there's nothing wrong with you starting now. And by that is at least making yourself familiar. Don't be upset with yourself by not knowing it all, especially if you haven't gotten through those classes yet. Okay. All right. But yeah. So what was I going to say? I failed my NCLEX 3 times, y'all. I failed first time, 75 questions. Second time, 265. Third time, 106. And then the last time I passed with 60 questions on my, and it was during COVID. Okay. So what I'll tell you is, don't give up if that's what you're trying to do. All right. Do not give up if nursing is what you want to do. And by nursing, I don't mean going to work at bedside. Now, going to work at bedside in order for you to go and to be a nurse practitioner in any span of most areas, or CRNA if you want to go up like that, you have to work bedside. But just because you're an LPN or LVN or RN does not mean you have to go and do traditional nursing at bedside. It does not. Okay. So remember, one step at a time. Pass your exam, right? Get out here, do what you need to do. And even if you don't know what you need to do or what you want to do, go to med-surg. And I don't shit on med-surg like that, because med-surg is a specialty. But you definitely will go and get your basic skills down as a nurse there. Thanks, guys. Do you have videos on all nursing skills? Pretty. I only have videos for the NCLEX. That is it. And so like the NCLEX is my bread. I mean, I can teach anybody in school. I can facilitate anything school related. I could teach psych, med-surg 1, 2. I can teach labor and delivery. I can teach, funds or foundations. I can teach all of that. But my bread and butter of where my passion is at is NCLEX, because NCLEX was the showstopper for me for 2 years. And so, I've honed in a lot of my knowledge in getting people over that hump. Nursing school, not saying that nursing school is terrible. It's all about the endurance, right, of getting through it. But I got through that, with a group of people. But NCLEX, that's a different monster. That was a different monster for me. Because Lord, I'm anxious for this ATI test tomorrow. So we can all pray internally, right? Amen. But you're gonna do fine. Hey, so here's the one thing, Bella, I'm gonna tell you for this ATI exit that you have tomorrow. I would most definitely tell you that you need to speak those words of positivity the whole time. Not one thing negative needs to seep from your lips at all, because you already know you speak it and it shall be so. You know what I mean? So nothing needs to be like, oh, fuck it. If I fail, I fail. Nope. Because there's some people that are like that. And I'm telling you that because that's some stuff that I said. Right. And so go there with nothing but positivity. All right. I got you. You were doing an awesome job. I appreciate it. Thank you. A lot of people don't realize how hard it is to make a course and how to stay consistent with it, or even how to get on here to get up in front of people. I remember I really wanted to start learning how to teach back in 2012 or 13. And I used to talk in front of a mirror. Mannerisms, inflecting, not pointing people out, but, asking questions. I used to do stuff. I used to practice. And if you think about it, that's how the greats do it. I remember Kevin Hart said he used to do stuff like that, like talking to a mirror, walk around the house, walk around with a piece of paper, read a script the whole time. So this is why I like doing this. And I've been teaching for 8 years. So now it's just, it's like involuntary. It's like, we can talk about whatever. You know what I mean? Thanks, Kev. You right. That's right. You got it. You ain't got nothing. Hey, if you scared, go to church. But as somebody said on my last live, hey, it's okay for you to be scared, but be scared doing it. You know what I'm saying? We all have anxiety at first. We all have, we're all nervous about the things that we're going to accomplish. That's a normal human interaction. That's a normal human feeling. So guess what? It's okay to be scared, but be scared while you do it. And then eventually you're going to be like, oh, I don't even know what I was scared of. You allow this, to psych you out. And that's not what we want at all. Okay. But y'all got it. Shout out to everybody. Hey, so if you guys are new here, we did NCLEX questions first half of this live, and now we're doing an Ask Me Anything, so you guys can ask me essentially anything that has to do with nursing, NCLEX, nursing school, pre-nursing school, all that good jazz. You guys can keep. Hey, if you guys are still finding value in me running my mouth, make sure you guys smash that like button. I appreciate it. I put you at 22,000. Appreciate you so much. Hey, Bella, you already know the deal. I got 20. It says 20. It says 21.9 on my side. What you mean? No, I appreciate you. But yeah, what other questions do you guys have? Marilyn Marillo, ma'am, thank you for the follow. I appreciate you. Hey, so I'm starting to do these NCLEX questions, every day. Hey, if you guys start seeing recycled questions, that's just because that whatever nurseslabs.com has for whatever their specific tabs, that's what I grab. And the ones that I grab right now are their comprehensive exams. There's only so many ways that you can ask a specific question. You know what I mean? So if it looks familiar to you, hey, cool. I guess kind of let it kind of go, let it do its thing. You know what I mean? So, but yeah, I want to know, if you're new here, I want to know who you are, where you're from, where you're at in your nursing journey, all that good jazz. So when are you going to do the one-on-ones? Is there a schedule? I want to take the NCLEX in January. So Bella, as soon as you look at as soon as you get the coaching, like you go to the website and you decide to get it, you can schedule it as much as you can schedule it out as far as you want. Now, here's the thing. My only thing is, if you decide to get coaching with me, you need to schedule your very first session with me as soon as possible. And the reason why I say that is that because I have a schedule I put you on. We talk about a tracker. We talk about NCLEX questions. We talk about mindset. The first time that we have a conversation is it's gonna be well over an hour. It's going to be well over an hour. All right. So that's why I try to tell people, like some people are just like, I only get 4 sessions. I was like, yeah, but you get an hour plus. So there's the last girl that I coached. There was one where we sat on here for about almost a little over 2 hours. All right. So here's the thing. And the thing about it, like we meet once a week, right? You get my phone number, right? So you text me back and forth. I create a tracker for you, so I'm able to see your progress as you're going along. You get nothing but motivation from me. Like I will call you, or you can call me. We can set up times in between there. If we have like a good 20, 30 minutes, and if you have a question or whatever that you need in between there, like I make myself available to you. So imagine this coaching, imagine this live, like I do all the time, but it's more personable. It's about you. It's more on an intimate level of being like, yo, let's make this happen. Let's make it happen. All right. Sounds good. I'm going to get my schedule together. I'm serious. I definitely want to do that. Do it. You can buy it. You can actually get it now. And if you wanted to, and then schedule it, you could schedule out all 4 of them. All right. And then if there needed to be any impromptu in between, we can make that happen as well. All right. With IK what? But a baby. IK what? Hey, if you guys are just now joining, we did NCLEX questions. We do NCLEX questions Monday, Wednesday, Friday, mostly. And now we're going to start doing them every day. Make sure you guys smash the like button. Make sure you guys share. Make sure you guys follow. Do NCLEX questions. All right. I'm actually going to start taking a poll to see like, hey, what section do you guys want to do next? You know what I mean? I will be honest. I need work on maternity. That's my weak point. Okay. All right, cool. And now I already have a mental picture, because now once I see a schedule come through my phone, instantly I'm on my computer creating a folder for you. Like you'll have like podcast recommendations. You'll have YouTube recommendations. If you haven't purchased the course, you get the 7-day NCLEX course. Like it comes part of the package. Like I said, you get those one-on-ones. You get my phone number. We talk about, hey, these are the things that I recommend that you look at. And then, like I said, the sessions are very, very much in depth. I'm actually working on, what am I working on? I'm working on a testimonial from one of the girls that I worked on, for her coaching when she took her NCLEX P and she passed on the first time. Explain the 7-day package again. I'm writing it down. So the package itself, you're talking about like the 7-day NCLEX course. So the whole point of the 7-day NCLEX course is to, instead of 3 days of doing a cramming session, at, somebody's facility, I break it up over a 7-day period to where I'm asking you, hey, give me an hour, 2 hours, 3 hours a day for you to get this knowledge in and understand your questions. Good night. See you next class. Yes, ma'am. Good night to you as well. And so I'm just like, give me a little bit of mine, because I know that your time is valuable, just like mine. So I create, let's go over some questions. Let's go over some questions per section. Let's break them down. Let's talk about the rationale, so that way you have a better understanding of it. And it's on demand. It's on demand, so you can do it as much as you want. And Bella, like I said, you have it forever. Even obviously you're about to go get your RN. You need it for RN. Cool. And then, like I said, there's content videos that are going to be going up there, all different types of stuff. But the whole point of it being 7 days instead of a 3-day review cram, it allows for you to absorb and retain it rather than me trying to cram all this information into your brain. All right. So that is what the 7-day NCLEX course is. And I'm working on a bunch of other stuff, y'all. I'm working on a bunch of other stuff. All right. And also for anybody that decided to, to buy any of the products or even get the freebies, I'm going to be sending you guys emails with new stuff. By the way, and I'm just saying, by the way, I'm actually going to be making I'm actually starting in January. I'm letting you guys know, January 5th, for the 11 people that are in here. No one, usually I would have like 200 or 300 people up in here, but for the 11 people that are in here, I am actually adding to my website a wait list for what I call we're going to make some shit happen on a tour of duty in 30 days, right? And I call it, it's the make shit happen or a tour of duty in 30 days. AKA, that essentially is going to be a group coach setting that we're going to do for 30 days. And I'm only opening it for 10 people. 10. I'm only opening it for 10 people. So if you guys want, the group setting of it being 10 people, right? Where you get the 7-day NCLEX course, where you get, you get a tracker, you get a schedule, you get all that stuff, that's coming down the pipe, like probably here soon, like in a week. And as soon as I get on this live, I'm going to put it on a wait list. And as soon as I'm going to like, hey, as long as you're on the wait list, I'm okay. But then I'm going to be like, hey, it's live. Go over there and check it out. I'm only taking 10 people for the month of January. And then the month of January, I'm going to see how it works. And then that's going to determine how many more we're going to do. All right. I did 1 hour cardio every day for 2 weeks and lost 0 pounds. Well, that sounds like a personal problem, and you might want to get that taken care of. Good night. It says, sounds amazing. I graduate in 2 days, and I want to take my NCLEX as soon as possible. Maryland, hey, if you're looking for anything, 7-day NCLEX course right here. Look, I had a guy who dropped one who he was like, I used your review. Somebody last week was just like, Kevin, I used your review and coming to the lives, and I passed my NCLEX first time. I love it. Kevin, are there mock NCLEX tests included? There are not. So the only thing that's included in my NCLEX, in my 7-day NCLEX course is only content at the moment. Only content. And I'm working, and trust me, that's one of the biggest things. My biggest thing is like, you have to understand content in order for you to apply them to NCLEX style questions. Now, NCLEX style questions are the bread to the butter, or the meat and potatoes to, you need to have all those, right? But the biggest thing that I'm working on is content. You want to know why? My whole thought process is like, some people are like, I didn't even know that. And I'm just like, well, let's get you the content so you can know it and how you can apply it when you get the questions. All right. But the questions are coming. The questions are coming. They're a part of, which is another reason why the whole course is $97. Now, when I add questions in there, it's going to be a different story. So, like I said, but hey, once I add questions in there, hey, if you have the review, you have the review. Okay, I got you. How do you feel about Hearst? My school is making it mandatory that we do it. I think Hearst is okay, but I personally could not do Aunt Marlene. That's what she calls herself. She's the creator, Marlene Hearst. She's the creator of the Hearst Review Services. I had the online version. I could not do it. Her accent, she's from Mississippi, y'all. Her accent, hardcore. Nothing wrong with a Southern Belle, right? But it was an environmental distraction for me. It was definitely an environmental distraction for me. So it's funny, Bella, that you say that. I had another guy that I coached who was up in in Dallas. And instead of him doing, he said the same thing, how his school made him do the Hearst review. And he was just like, I'm going to take a chance and I'm going to use you. And I'm like, all right, cool. Come on. So the same exact thing. And as a matter of fact, you actually are getting more. This was last year when I coached him, and he works in an ICU now, by the way. He pretty much said the same exact thing to me. He was just like, they made us do it. So, but I'm going to use you. And he was just like, it was so much better using me because he was able to get that immediate feedback on what he was messing up on. And also we break down NCLEX style questions together. I go through your quizzes with you. I'm like, hey, so tell me the ones that you have a problem with, and we'll go straight to them. If not, we're going to start from the beginning, and we're going to go through them together, and we're going to break them down. And I'm going to show you why you didn't get it right, and I'm going to show you why you got it and why you got it wrong. Or, hey, let's talk about this. Hey, something I want you to think about, like little tidbits and stuff like that. Hey, if you guys are joining, welcome. We did NCLEX questions. Now we're doing an Ask Me Anything in regards to nursing, NCLEX, as well as, the nursing, pre-nursing, nursing career, whatever. So if you guys have any questions, make sure you guys leave them down there in the chat. Hey, if you guys are also finding value, make sure you guys smash that like button. Y'all got me to 20,000 likes. That made me happy. So I really appreciate it. Y'all got carpal tunnel for me. That made me happy. You know what I'm saying? So also, y'all, I'm actually going to be updating merch. I don't know if I'll be selling it through TikTok or whatever, but I'm going to be making some new shirts. I used to have mugs and I used to have thermoses and all of this stuff, but I don't want to do that anymore. I think I'm just going to stick to shirts, and I got a couple in mind. So you guys, that merch tab that's in the link in my bio is going to update. All right. I'm really thinking about taking a chance with you too, as well, because I learn so well from you. Look, the thing about it, here's the thing, is that working with me specifically, it's an investment. Like, if you think about it, people will blindly put money into their 401k and give it to somebody that they don't know to put it where that person feels they're going to make the most money. So, generally it's okay, but then you start losing money. Like I started losing money when COVID started happening, right? So people will blindly give other people money and they call it investing. But the moment that you try to tell them to invest in something to help them grow, that's when they start like kind of throwing weird stuff at you. Now, I'm not saying that about me because I know what I've done. I know me, right? And me being on here is no different from if we're having a video call. And there's nothing different. And the thing about it is, like, we're not going to get off that call until you understand. right? But best believe it, I will hold you accountable. I do. Accountability is a very big thing with me. I had somebody say to me flat out, well, Kevin, I guess. And I was like, no. There is no guess. You aren't doing what you're supposed to be doing. And that is a you problem. And I'm going to need for you to fix that, as well as I'm going to need for you to understand that you need to be accountable. I already have my license. You know what I'm saying? You want your license. I want you to have your license, but I can't want you to want your license more than you want it. You know what I mean? You know what I'm saying? Y'all find it value? Smash that like button. It says, how soon can we start when we pay? Maryland, if you have it forever. You have it forever. Now, there's enough information in there right now that'll stimulate your brain, that'll really help you, especially because there are 8 videos of the new generation NCLEX where it's a video of me where I break it down. Okay. So what I'll tell you is the 7-day review, which consists of management of care, pharmacology, physiological adaptation, health and promotions, basic care and comfort, physiological or psychosocial, and I forgot what the other ones are, but those videos are still in production, and those are actually going to be going up here within the next week to 2 weeks. My goal is to have all 7 of those videos up by the 15th, or that weekend of the 15th. But as soon as you get it, it's yours. You can pop it open. It's on demand. Would you like for me to show you? Maryland, if you would like for me to show you, just tell me yes, give me thumbs up, whatever. But hey, if you guys are new here, welcome. We were doing NCLEX questions, right? We were doing NCLEX questions first thing, right? And now we're doing an AMA. But since Miss Maryland was so curious about stuff, give me 1 second. Let me turn this around. So, oh, Lord of mercy. Lord of mercy. Bring that down some. All right, here we go. I'm going to show you. So when you go to the link in my bio, this is the page that is going to pop up, okay? Conquer the NCLEX in 7 days, right? And then once you get there, you can scroll down. You can look at the testimonies. It tells you what we cover. We talk about the structure, critical thinking, pharmacology, management of care, so on and so forth. I even have the curriculum laid out, right? All the curriculum. And then you're going to see stuff in this curriculum that hasn't even been added yet, but those things are going to be added, right? Also, you get to be a part of the Facebook group, as well as that's me when I worked at the Burn Center, right? That's a nice little picture. Hey, those are snips, by the way. If you guys are asking what kind of shoes those are snips in my story, right? And then we talk about who the course is for, testimonies, right? Other people that have talked about me, and it's for $97. Okay, $97. Sorry, at work trying to tune in. Miss Butter Baby, that's okay. Hey, that's okay as long as you're here, right? And then once you get it, this is what's inside. Maryland, I don't know if you're still with me, but this is what's inside, okay? I'm going to bring this down. I'm going to open this up just a smidge, right? So over here, this is my pharmacology section, right? 18 videos right there, right? And then also, here goes, you can't see the screen? Here, let me back it up. Can you see it now? Give me thumbs up if you can see it now. All right? And so here we have the new generation NCLEX review right there, okay? That's the new generation NCLEX review. Let me mute this because I already know it's going to be stupid loud, right? So this is where we go over questions together. Well, essentially where I go over questions and we talk about them. And then we read them, talk about the rationales, so on and so forth. There are 8 types of videos that are on here. I just feel like I'm going to learn content. I just feel like I got to learn content over. Don't feel that comfortable for content from school. And that's the thing. That's why, you know, we go over the most important things, right? Like you want to know what the content, what the type of questions look like, right? So here, I'll start it from the beginning. This is part number 1 where we go over the NCLEX, talk about the intro, you know, the things about how it updated, you know, the new types of questions, the test plan structure, right? The length of the exam, and then we jump into questions, right? So 60 to 70% of your exam is still going to be multiple choice and select all that apply, right? But then as we go through, you know, we still have, you know, our case studies. And I know that's what probably somebody's like, oh, I wonder if he has case studies. I got you. So let's check this out. Let us find the case study, right? So there's one case study right there, right? Well, we talk about, you know, we're caring for a 68-year-old client, right? And you get all the information that you could ever need from this patient, right? They talk about, you know, you get the vital signs, you get You get the general impression like, hey, you know, what is it? The client comes to the emergency department with progressively worsening shortness of breath and altered mental status for 2 days. Okay, cool. Now I already know I can kind of paint the picture. You know what I mean? And so then, of course, our next question is, what is this? A multiple choice question, right? And then we come over here, still part of that scenario, but it's a second question based off of that scenario. Now we have our select all that apply, right? And then we have our scenario again. And then we have our closed or our drop down, right? And you pick from one of those, right? And then we go over to our let's back up. We have our anticipated versus not anticipated, right? So I talk about these, right? So, you know, and I'll even talk about the topic, you know, based off of what was going on with the case study. I even give you the topic because it actually will help you hone in like, oh, okay, yeah, I remember with COPD, they're going to want to use, you know, antibiotics or corticosteroids or stuff like that. You know what I mean? And then we talk about what's answers right, indicated versus not indicated, right? As well as going through other questions. And I have the bow tie questions, you know, the matrix types of questions, you know, the ones that everybody loves oh so much. Also, let me show you guys. Look, dosage calculation, right? Dosage calculation. Notice how we break that question down. We talk about that, right? Break that question down and then boom. This is what, you know, how, when you're working it out on your little white sheet, this is what you should see, right? Okay, and let us find, oh, there it is. I found it. All right, boom, bow tie. All right, so we talk about the bow tie based off of the information that we got from the case study. Remember, your case study is going to give you all that information. Plus, when you get through your 6 questions, you can and will get updated information. Just like if you were taking care of a patient on the floor, like they came into you they came into you stable. Now they're unstable. You know, okay, cool. Now what is most likely happening if they're unstable? Okay, now what action should I do? And then what should I watch out for? You know, how should I monitor this patient based off of their newly acquired issue that they have? All right. And that is what is inside the course. And like I said, with this review, these 8 videos alone right here, these 8 videos, that's almost 4 hours of content. I think it ended up being like 3 hours and 56 minutes, but I split them up to be less than 30 minutes because who in the world wants to sit in a review for hours at a time, even though you can pause. So instead of pausing, I just take it away from you. Hey, give me 30 minutes. Marilyn, give me 30 minutes. Yeah, like watch this video, take notes. Yeah, okay, cool, got you. And then we go over here, like so. And then like this is all content. And then pharmacology, talk about dosage calculation, how to study pharm. Remember, pharm is the second largest section on the NCLEX. That's why I threw it up here first, right? Management of care, we're working on that as well. But like, look, let me show you right now. We're gonna go to pharmacology, right? And we're at the cardiac meds, right? Talk about the intro for cardiac meds. What else we got? We talk about ACE inhibitors. We talk about ARBs, right? Or statins, right? ARBs are statins, beta blockers, calcium channel blockers, right? You want to know why? Because look, all our calcium channel blockers are what? Dipine, unless it's verapamil or cardiazem or diltiazem, right? And just a good way to remember, hey, dipping in the calcium channel. Yeah, that's money. Hey, that's what I'm talking about. That's money right there. Statin, right? And then we talk about anticoagulants. We talk about diuretics, anticoagulants, antiplatelets, digoxin. These are all the important meds that you need to know cardiac med wise. You know what I mean? Like you got to know what everybody else knows, right? Talk about contraindications, right? Adverse effects, right? Then talk about nursing considerations that you need to realize. Oh, and then there's a critical thinking question at the end of each lecture. I'm sorry. They're at the end of most lectures, not all of them. They're at the end. And then we talk about a conclusion, some key points to remember, right? And then me talking down here in the corner. I don't know if you guys can see it, but yeah, down there in the corner, me running my mouth, you know, all that good jazz. All right. But yeah, that's what it comes with. So hopefully that answered your question, Marilyn. Shout out to all 10 of y'all that are in here rocking with me. I just showed you guys the 7-day NCLEX course. Yeah, that's what's inside the NCLEX course, y'all. And like I said, you get it for $97. You get it forever, for a lifetime. You get it for a lifetime so bad that you can pass it to your descendants. That's what somebody asked me. Can I pass it to my descendants? I was like, you sure can. You sure can if you want. All right. But yeah, what other questions do you guys have? Marilyn, if that worked out for you, if you have a good understanding, just go ahead and give me a thumbs up. Thumbs up. All right. Hey, just jumped on cute nurse. Hey, just on. Do you suggest this even prior to ending school before testing? Absolutely. Absolutely. Because I can tell you right now, I don't know when you graduate school, but I have people that just started nursing school. I'm sorry, that don't start nursing school until January that bought it. So, and they got it when it was $48, right? And that's when it was pre-launching, right? So, I mean, for $48 or for $97, you get it, you have it forever. It's good for RN and LPN, you know? So, it's definitely good, in my opinion, right? Hell, just the new generation NCLEX review that's in there with the 8 videos is enough. Start LPN to RN Bridge next week. Shout out to you. Oh, yeah. If you're starting your program, I would definitely get it now, because you're going to get all the updates. And you already being an LPN already know how much reviews cost, and for the fact that reviews are all on the subscription base. And mine's not on the subscription base yet. Yet it is not. All right. But hey, shout out to all 7 of y'all in here rocking with me. Hey, what other questions do you guys have? What other questions do you guys have? Hey, also, I made an ebook. You're welcome. Also, I made an ebook if anybody is interested in that. That link is also in my bio. Of course, there's a freebie on there. You guys can get that freebie. 42 pages of test taking strategies, of those important labs and all those other good things that you need to know for on NCLEX. Even though they're going to give you the lab values, you need to know what is happening to your patient if it is below or above that lab value. And also what your nursing responsibilities are when that happens, right? So if I have a patient that has a potassium of like 9, what you gonna do? If they have a potassium of like 2, what you gonna do? What is it displaying? So on and so forth. Excuse me. All right. What other question you guys have? I'm gonna hang out probably for about another 5 minutes. Appreciate everybody that's staying and rocking. You know what I'm saying? We'll be here tomorrow. Also, once again, to all 7 of y'all that are in here rocking, I am working on what I like to call making some shit happen in 30 days, where you come, essentially come take a tour of duty with me. You know what I mean? I'm a military guy, very military-esque. We're going to take a tour of duty where we will essentially do group coaching. It's essentially your tour of duty is group coaching with me, but I'm only taking 10 people. I'm only taking 10 people. So what I'm going to do is I'm going to make a wait list, right? And so I'm going to do it in January. Looking to work in the ER when done. Have you done ER? So I worked in the ER when I was an EMT long time ago, like in 2008, 9, 8, 9, 10. It's wild. It's controlled chaos. Controlled chaos. Controlled chaos. Definitely jump in there as much as possible to get your hands dirty. And my hands dirty, I don't mean that. Well, you know what I mean. But jump in there and get your hands in there. My question, NCLEX, is it is difficult. Are you asking me or are you telling me? Bonus is what's so special about your product versus the other the other ones for information. So the biggest thing that separates me is, what story do you know about any of these big ones that are out here? Because that's essentially what they are. They're bigger than me. I'll use UWorld, Archer, Kaplan, Hearst, whomever, right? I actively get on here and I talk to y'all and I give y'all free game all the time. If it's anything from advice or, when you're in nursing school, how to practice for your exam, whatever, right? Secondly, I failed my exam multiple times. And for somebody to openly come on here and tell you that they fail, and it's okay that you fail and you build upon that. So, because only people that are failures are the people that quit. So me, I wasn't going to quit. And so I created a course that I didn't want anyone else to feel that way. And now I know that the course works, even with the 54 videos that are in there. Even with this, it still has helped people. And so this review is more personable. It's because it's like you actually know who I am, even though you don't know who I am. You know what I mean? If that makes sense. So that, I'm not saying that I'm better than anybody, because it's all based off of your perception and what's your cup of tea. Am I your cup of tea? And if I am your cup of tea, however you get me like this is how you would see me somewhere else. So you'd be like, hey, if you saw me in public, hey, Kev, I bought your review. I really like it. I'm like, hey, man, I appreciate you. You know what I'm saying? And if you had any questions for me right then and there, why would I not answer your question? You know what I mean? So I guess it's more about, like, what is your cup of tea? And I appreciate that. I appreciate you, number one, asking me that. That way I'll give you a legitimate, from the heart answer, because I've told people, I was like, hey, I like their questions. Hey, I like their questions, but I'm here giving you free game. I'm here, every day with y'all. Y'all are rocking with me, which I really love. You know what I'm saying? So it's like the relationship is different. You know what I mean? That's just like, hey, you got a shirt? I'm going to buy that shit right now. I don't care. I mean, I do care what it says. Okay. I do care what it says. I'm already sold for you. Hey, I appreciate you. I have a question, a little off topic. Is it Misha? You're welcome. You're welcome, butter baby. Misha, what is your question? If it's okay, it's off topic. So let's see what the topic is. What job did you work while you were in nursing school? Misha, I was active duty in the Navy while I was in nursing school. I was active duty in Navy while I was in nursing school. So I had a full-time job where I was actually an instructor teaching students. And then I, go home, study, and then I did clinicals on the weekend. So I worked full-time and, family and all for, 18 months, because that's how long my program was. So my job was the U.S. Navy. So, and if you're asking if you can work during nursing school, absolutely. 100% you can. Yeah, trying to figure out school and work. Yeah, I work. Yeah, so here's the thing. It's just like, I would never tell you, ever. I would never tell anybody, hey, yo, fuck that job. Go be a nurse. Never would I tell you that, because you got to take care of yourself. You have to take care of yourself. You know what I mean? You got to take care of yourself financially. You got bills. Bills don't stop because of nursing school. Even though these fucking nursing schools are just like, you need to be studying 40 hours a week. Bitch, I work 40 hours a week. What you mean? So, yeah, but it's definitely doable. Full-time urgent care. Yeah, there it is. It says, oh, wow, I commend you. I'm struggling to figure that out. And that's what I'm trying to, Misha, so that's what I'm going to tell you. I'm going to put you on game right now. And you're probably going to be like, oh, well, duh, Kevin. But let me tell you, I literally had, I printed out a calendar from Google, a Google calendar. And I literally printed it out. And I'm one of those type of people where I have to write it down. Look at that. You see my brain right there on the board? I have to write that out. And I have to walk past it every day. And I'll be like, yep, I said that, I said that, I said that. So what I did, I had to print out a calendar and I wrote down everything that I had to do. Like if it was studying for NCLEX, studying for questions, whatever. And then I actually got an Excel spreadsheet, and I had to fucking literally audit my time every hour on the hour to include job. So if I knew I had to be at work at 5 o'clock in the morning and I wasn't going to get home until 6:30, I knew I had to make it work. And I hear people say, it's like, well, I can't do it. And I was just like, well, it's doable. It's just if you're telling me you can't do it or you're choosing not to do it, which one? Are you choosing not to adjust? That's what these programs want from you. They want to know, can you adjust? Remember, hey, getting into nursing school, taking these tests, taking the NCLEX, these are things to keep people out. These are things to keep people out. When people start complaining about their schedule, they're going to be like, all right, cool. You're one less person I have to worry about. It's to keep you out, right? Because think about it. If everybody could be a nurse, if it was easy, everybody could be a nurse, right? That's why they make the entrance exam part of that thing. That's why they make. That's why they do everything based off of a point system, right? That's why they do that. They're like, oh, let me see how much better this person is. They don't got to fucking know you. It's all based off paper. It's not like you're presenting, a profile picture to them. You do have to make a sacrifice, absolutely. And so the thing about it is like, what sacrifices are you willing to make? Are you willing to be part-time? Are you willing to not go on a vacation? Are you willing to not buy a Mercedes? Please don't buy a Mercedes. When you graduate or when you do any of that, don't do that. Because first of all, money is expensive out here. You know what I'm saying? It's expensive to print these motherfuckers. So don't be going out there be trying to just fucking splurge because I ain't got the money. You damn sure ain't got the money. But yeah, like the whole point of that is to keep people out. That's the whole point of why those things for nursing school are there, is to keep you out, for sure. So I hope I answered your question. What other questions do you guys have? Shout out to all 80 y'all that are in here rocking with me. Hey, we did NCLEX questions, started at 5:30. Well, a little bit after 5:30. I wanted some folks to come up in here. But we do NCLEX questions. You're welcome. You're very welcome. And then you usually do that for about like an hour 15. And then I turn around and we do an Ask Me Anything. We talk about NCLEX. We talk about nursing. We talk about career choices. If you're a pre-nursing student, what are some things that can help you stand out when you guys are going and applying for nursing school? As well as different, nursing jobs that you guys can apply for. You don't have to work bedside as an LPN, LVN, or an RN, y'all. I need all 9 of y'all to understand that. You don't have to go work at somebody's hospital, get underpaid, and get fucking overworked and then treated like shit. You don't have to do that at all. Know what I mean? You ain't got to do it. So my question is, what questions do you guys have? What other questions do you guys have? All right. Well, I mean, I won't sit here and talk to myself for what? Miss Cute Nurse 89 for what? Do you have to have a shot? So in order to go to nursing school, you do have to be up to date on your immunizations. They draw labs. You have to get your immunizations. You have to get your fingerprints done, all that stuff. Misha, you said you have several questions. Fire them away. It says testing sites when you leave the room while testing. What do you mean? Did you ask me something else? I didn't see it. What do you mean? Cute nurse. I'm gonna wait for you to respond. Misha, if you got several questions, girl, you better drop them. I'm about to get off here. I said I was gonna get off like at 7:15. But it's already 7:20, and I'm definitely gonna get off at 7:30 because I got content to create, y'all. I got content to create for y'all. All right. What do we think? It's like, no, several shots. My bad. Oh, so yeah, you do have to get several shots. And then if I do remember correctly, they are making it mandatory for people to get COVID shots. However, that depends on the school. All right. So when you go to the restroom while taking NCLEX, you have to scan in and out. Yes, you do. So this is why I say when you practice, building your endurance, right? Because you can actually get through that test in like an hour or even or a little over an hour and then not have to go to the bathroom at all. To make sure to make sure it's you and not. Yes, they do. Because guess what? You have people that are twins that do that. You know what I mean? So they definitely want to make sure that it's you, because that's why they hold the integrity of it so high. That's why when that whole thing that was happening in Georgia and Florida about the fake nurses or Operation Nightingale, you lose the integrity of the program. Imagine working with somebody who bought their license and they've been working with you. And then all of a sudden, they tell you, yeah, I didn't go through nursing school. I just bought it. Like, how pissed off would you be? Number one, you'd be like, bro, you think you can just buy a license and come over here and not go through the struggle that I went through? Number two, bro, you are an unsafe person because you don't even know the basics of what's going on here. Like, you're unsafe and you're dangerous. You know what I mean? So, right, be aware of that. Because that's why, like, once again, that's why I said that those steps are in place. They take pictures of you. You put your body, like the hand scanner. Yep. All that fingerprint. Yep. It's kind of like where you go to the DMV and you got to get a new driver's license. Yep. All right, y'all. Well, if you guys don't have any other questions for me, I will let everybody go tomorrow, 17:30, 5:30 Central Standard Time, right? Because that's the only time that matters because it's in Texas, right? We will be doing NCLEX questions. Have a good night. You as well. Last little plug. Hey, make sure you guys check me out on all those socials. YouTube, Instagram, Facebook. Those links are in my bio. All right. Everything is at The Boot Nurse. Also, $97, y'all. $97 for the 7-day NCLEX course. You get lifetime access to that. All right. Lifetime access to the 7-day NCLEX course. All right. I also created an ebook. You guys can check that out. You want to do one-on-one tutoring with me? That's up there as well. If you want to do coaching with me specifically for the NCLEX, that's a bigger package. That is also over there as well. And check out the 7-day NCLEX course. /special. Hey, I got a freebie over there, talking about test taking strategies, 42 pages worth. Okay. But yeah, you guys be great to yourself. You only got one you, so make sure you guys do the best to take care of you. All right. And I will see everybody tomorrow.